I want to welcome 3 doctors from the Madison campus family who practice at 3 separate hospitals here in the Nashville area. Joining me are Dr. Alberto Gonzales, Dr. Kenneth Palm, and Dr. Warren Downs. I've asked them to come and talk with us because I know that there's a lot of questions that I have, and I'm sure that many of you have, about what's happening in our community regarding COVID-19. And so thank you, doctors, for being here and for giving us your expert input on what you're seeing and what's happening in our community. I'd like to start off, and feel free, whichever one of you wants to start things off, feel free to do it. I'd like to start off by asking the question, we're hearing news reports about a surge in COVID-19 cases. What are you seeing in your hospital?
Well, I would say, I work in the emergency department, and we are definitely seeing just an ongoing increase in the number of patients who are presenting with COVID and COVID-like symptoms. I think as far as our admissions, we're seeing at least over half as many admissions for COVID, or half again as many admissions for COVID as we were seeing just a month ago. So we're also seeing an increase in the number of ICU admissions. So we're definitely seeing an increased volume, and it's sobering.
It's the same situation in our hospital. The numbers are increasing. People are presenting with symptoms sometimes that we don't expect to be related to COVID, things that are unexpected. I think that in general, Nashville has grown too fast, and our resources are already challenged because the infrastructure has not been able to keep up with that. So we add this on top of that. So that's putting a lot of strain. The numbers are going up, on the resources too.
So COVID has become a daily routine part of what we see. And what we're seeing is that the percentage of patients that we're seeing is going up and up. And what is interesting in some ways, because of course we're seeing COVID patients that are coming in just with COVID, is that we're seeing patients present in ways that you might not expect. So people that don't know have COVID get weak, fall, break their hip, and come in, and possibly the cause of their broken hip was that they were weak from having COVID and fell and never knew that they had it. And then, just as some of our infectious disease leaders predicted, we are seeing a definite surge in COVID cases based on families wanting to be together and seeing each other, and the increase that has caused.
How concerned are you by what you're seeing in your hospital?
Great. Go ahead.
Yeah, go ahead, Alberto.
Yeah, it's the numbers are going up, and we see also the population that are presenting. We see a lot of older people that tend to not do well, and the problem is that it doesn't seem like we're going to flatten at any point. I mean, the numbers are rising, and I don't see how we're going to at some point at least reach a plateau and begin to see things going in the other direction.
Yeah, I think just from the emergency department standpoint, what we're seeing is just an increasing volume of patients. And with that increased volume of COVID patients, that's obviously crowding out the other patients that require care as well. So this is having a multi-pronged effect on patient care.
Of course, my perspective is as an emergency physician. So we see the patients as they first come in. The challenges are that on average, patients coming to the emergency department are sicker than they used to be, because people are avoiding the emergency department for minor injuries or illness. Some because they walk through the doors and there are 20 people sitting in the waiting room, and they turn around and try and figure something else out. And then also some because people are trying to be more careful, But a lot of it is impacted by the fear of COVID, but also what it has done. So what it has really affected for us is that the hospital is so full of other illnesses and COVID that it is difficult to move patients out of the emergency department once we diagnose them or determine they need in-hospital care. I heard a number, I don't know the actual percentage, but I heard that 30% of our hospital capacity is currently taken up by patients with COVID. And that's a 30% capacity that we didn't have a year ago. And this time of year, the hospital was typically running about 90 to 95% full. So as people that can do math, you take 90% and add 30%, that's over 100% capacity. So that capacity then stays in the emergency department, affecting our ability to take care of patients as they come in. Our fear is that at some point, sick people may come to the emergency department and we won't have the ability to take care of them because we won't have the staff or a place to put them. We haven't gotten there yet. No one has died in our waiting room or in an ambulance outside our doors, but that is what we fear, even though that has not happened yet.
How concerned are you about what you're seeing?
Well, I'm very concerned because our numbers overall are not terribly different than California, and we're still rising. And what we're seeing in California is that patients that were previously transported to the emergency department for an attempt to save their life, however small that attempt was, aren't being transported anymore. And again, this is a very small number of cases, but it's serious. And there are colleagues that are blogging and saying things about how desperate their situation is, such that in the Los Angeles area that there are 0 available intensive care unit beds. And you think, oh, well, I'm being pretty careful, I'm healthy, this won't affect me. Well, it does, because I had a trauma patient just yesterday and he had a brain injury. He needed an ICU bed. Fortunately, we still had one, but if he had been in Los Angeles, he might not have had a place to go because it was full of patients with COVID. So even if you've had COVID and feel you're relatively immune, people still have strokes and heart attacks, and sometimes even a combination. I had somebody with COVID having a heart attack yesterday. So COVID has downstream effects on everyone, no matter how healthy. I fear when I go for a bike ride that if I crash and break my leg, that I might be in the waiting room for 3 or 4 hours waiting to be seen because the ER is full, and not because people are necessarily being bad people, just that's what the disease is doing.
How is this impacting you personally?
Well, I can say, that I have been working, of course, closely with other emergency faculty, and we've been concerned that we were going to contract the virus, and a small percentage of us have actually contracted the virus. And I think of 2 specifically, 2 faculty, one who is in her 40s, doesn't have any kind of comorbid conditions, healthy, and she continues to have symptoms even after 6 months. A second faculty member who also healthy, he's a runner, he's in his 50s, he contracted COVID, and he had involvement of his heart valve, ended up having heart surgery. So those are very, that's very near and dear to me, obviously, because these are good friends of mine. and it's impacting us on a very personal basis.
It's the first time in my career where going to work potentially threatened my life. I was talking to a patient just the day before yesterday, and he was retired U.S. Army. And, you know, it is not the same thing as getting shot at. You know, my percentage chance of even getting sick or dying is very small. So not necessarily comparing the two, but I had a little bit of that feeling of what is it like to go to a job where it's not just hard or challenging or stressful, but that I could get sick, I could bring that home to my family. You know, I always thought about it before. I could catch a cold, I might get the flu, but never thought of it as I could catch a deadly disease and come home. I admired those that would go over and volunteer in Ebola outbreaks and thought I would never do that. And well, not Ebola, but it came to us. And so, you know, it creates a different stress, and it's something that I don't think you can avoid bringing home to a certain extent. You know, my family has seen it in me, and it is challenging, and because it's getting worse when we were hoping it would be going away, you know, it does carry on. I have the blessing of a vaccine is here now. And being a frontline provider, that is something that has been provided to me, and I'm certainly very thankful for the skills of the people that have invented or created that, and I'm very hopeful that that is the beginning of our end, if you will. But it's just barely the beginning. I was joking, a colleague and I were joking that back in March, when we were all afraid and locked down and being so careful, that there was this tiny little bit of virus out circulating. And now that the number of people with COVID has gone up exponentially, how it is so much easier to kind of relax and go sit down in a restaurant and take off the mask and not worry because, well, I didn't get it last time. And now is actually when you should be a little bit more careful because your chances are so much higher.
From my standpoint, I echo that. Not only what we see in the amount of pain that see, you know, people, families, and it has changed what we understood about medicine, the way we have to approach medicine. It has have to rethink the way we do many things, you know. But again, the concern every day we go in worried about, you know, contracting the virus. And not only, you know, how that impacts our health, but also since you know, we're, you know, at this point where necessary, there's a lot of doctors to go around and nurses. You know, how, you know, we get sick would impact also, you know, the care we can provide for the people that need it.
What advice would you have for your fellow church members and the public in general?
You don't really want to get this virus. I'm telling you, it looks miserable from the patients that I've taken care of. And so I just strongly advise you to do the simple things that we've talked about over and over again. Certainly wearing masks. Masks, I believe, is what has saved us or our faculty and our staff from contracting the virus in a percentage that I was concerned we were going to contract. And other things I would say is, like, just avoid eating indoors with visitors. If you have them, try to eat outdoors if you can. Try to avoid eating in restaurants. Those are just high risk areas. And also, get vaccinated. It's so important that you get the vaccine, not only for yourself, but for your friends, family, and your community.
The other aspect that I see is, after this is going on for such a long time, people are beginning to feel this is a norm. and beginning to feel fatigued and burned out. And so it seems that people don't care anymore. And they're lowering the defenses. You know, people begin to forget the things that are important. Wash your hands, cover your face. Try to avoid crowds. You know, minimize the places where you go out. You know, order your groceries to the house. Things like that. You know, just minimize the contact out there. And but people are forgetting. You know, we're tired. We don't see the end of this. The kind of people are blocking it out, ignoring it, and I think that's part of why we're seeing what we're seeing.
So we learned that the consequences of a lockdown are huge, both emotionally, financially, and that, yes, it was quite effective. We took a spike of coronavirus and watched it as it went up, and we watched it come crashing down. And so we know it works, but we know that there's a cost, and it is a cost financially, but it is costing in personal loss as well, in terms of loss of contact with friends and family and those things. And it's that cost, I think, was higher than we as a country are willing to pay. But that doesn't mean throwing the proverbial baby out with the bathwater. It doesn't mean take your mask off and let's have 1,000 member meetings at a sports bar or at a church or anywhere. Maintain your social distance. Create a circle of friends and people that's small, that you feel comfortable with their behavior, that it matches your own. And wear a mask whenever it is feasible. Obviously not with the immediate family, but at 24 hours a day at home, but wearing it everywhere else you go, and doing the things that are recommended by our infectious disease leaders. And I mean the people that actually have expertise, like the Dr. Fauci's and the CDC, and that. What they've done, this is a career-defining moment. It's what makes them energized and go to work. No one wants it to happen, but and also recognize that recommendations will change as we learn more. I was not a mask advocate in the beginning. It's like, well, they don't prevent you from catching a virus. Well, partly you're a little bit wrong, but also when everybody wears one, it helps prevent the transmission. So we have seen that in a lot of the Asian countries, is that they were early mask adopters, and they just haven't had the spikes and those things that we have had, because, well, we got it wrong in the beginning. Now we're trying to get it a little bit more right.
I want to thank all of you for taking your valuable time to share what you're seeing. Is there anything else you want to share before I let you go?
Thank you, Ken, for bringing us on.
Absolutely.
Thank you very much. And I will remain available to help and provide whatever we can do.
Well, like I said, I greatly appreciate all of you. I appreciate not just you sharing with us, but what you're doing, putting your life on the line by being out there. And it's not just yours. I'm sure one of the things you have to think about is going home to your own families and what that could mean. So I truly appreciate you. You guys are heroes in my eyes, and I'm sure everybody else in our church. And we appreciate you, and we're so happy you're part of our family. God bless you, and have a good evening.
Thank you.
Thank you.